Hello, my name is Shara, and we are doing a special report on the human papillomavirus. This virus is said to be one of the most common STDs, according to the CDC, and will affect up to 50% of people in their lifetime. We are talking to Dr. Linden, who has been researching this disease for the past month. Dr. Linden? Hello, thank you for having me. It's so nice to be here. So I have been doing an in-depth study of the human papillomavirus over the past month. And because of how common it is and how devastating it can be, it is very important to have a better understanding of this disease. What are the causative agents or the pathogens of the human papillomavirus? The pathogen or the causative agent for the human papillomavirus is a group of non-enveloped double-stranded DNA viruses, which they belong to the Piperviridae family. They infect the cutaneous and the mucosal epithelial cells of the anogenital tract. The human papillomavirus is also the causative agent to most cervical and penile cancers. So what are the virulence factors for the human papillomavirus? The virulence factors for the cancer-causing HPVs are oncogenes. These code for proteins that interfere with the normal host's cell function. They result in an uncontrolled growth of malignant cells. This virus preferentially targets the squamous epithelial cells. What is the epidemiology for the human papillomavirus? The epidemiology of the human papillomavirus is that according to the CDC, 50% of the sexually active men and women have the potential to contract a strand of the HPV virus. Now, there are over 100 different strands of the HPV virus, and some are cancer-causing and some are not. But do you want to take that chance? Ooh. It is estimated that 14% of female college students have the chance of becoming infected with a strand of the HPV virus this year. How would you diagnose someone with the human papillomavirus? It is very difficult sometimes to diagnose this disease, as a lot of people are asymptomatic. But there are different ways that you can protect yourself. And one of those ways is yearly pap smear screenings. This has reduced by 74% cervical cancers since 1955. This is the best way to determine if you have an HPV-related cancer. My job as a lab technician is to prepare and read the slides and send the reports on to the patient's doctor. So how we typically do that is we will take the sample from the pap smear and we will adhere it to the slide and preserve it with a fixture. It is then viewed with the microscope that is attached to the computer so that we are undeniably certain that the slide we are reading is in fact cancerous or not. How would you get the disease, the human papillomavirus? The transmission of this disease is direct contact, most oftentimes through unprotected sex. But basically, at any point in time, rubbing the warts onto different parts of the body. What are the signs and symptoms for the human papillomavirus? Like I said, a lot of people go through their lifetime with not even realizing that they have this disease. They're carriers. They're asymptomatic. They don't have any outward appearances to let you know that you have this disease. But if you happen to have some of the signs and symptoms, there are small flat discs, warts on your skin. There also could look like the cauliflower branches. They can range from small to big. It just depends on the strand. They can show up in your genital area, anal, and throat. How can we prevent or protect ourselves from getting the human papillomavirus? There are several ways that you can prevent yourself from getting this disease. One way is there are two different types of vaccines. Gardasil, which prevents against 4 of the most common carcinogenic HPVs. And the second vaccine is Cervarix, which protects against the top 2 strands, HPV 16 and HPV 18. You should start getting these vaccines between the ages of 11 and 12 in both boys and girls. And you should go through all 3 of the doses for each of these vaccines. The second way you can prevent is never have unprotected sex. You should also have regular pap smear screenings. What are the treatment options for the human papillomavirus? The main treatment option is removal of the warts. It's very easy. It's similar to removing a plantar's wart or a typical skin wart. But if you have the removal of these warts, it does not mean that you're HPV free. It means that you still can be a carrier. You still have the disease. The results of the infection are treated, but the viral infection is not amendable to the treatment and relies heavily upon the activity of the host immune system. Current studies show that even when the tests for viral DNA are negative, they still may reside in an infected female for 20 or more years. The treatment for the cancerous cell changes are very important to your HPV therapy as well. Thank you for having me.